Peripheral vascular disease is like a beast that has left many of our patients, like this one, Mr. Vega, in a wheelchair, dependent on others. In our show today, we're going to give you information on how you can protect yourself against this disease, peripheral vascular disease. I am Dr. Cooper-Dockery, and welcome to Get Healthy with Dr. Cooper.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Dona Cooper.
The incidence of peripheral vascular disease is on the rise. There's so many diseases that can lead to this condition. Diabetes, for example, heart disease, smoking, all these are factors that can lead to peripheral vascular disease. Peripheral vascular disease can lead to amputation of the toes, amputation of the leg, or even both legs. And this is a leading factor or cause for disability. Today, I'm in the home of a patient, and I'm here to get his story because many of you probably are having a similar situation. Mr. Vega, how are you doing today?
Okay.
So, Mr. Vega, I noticed that you have one leg and amputation just below your knee.
Yes.
When did you have the amputation?
In April.
In April. What happened?
Well, my foot kept getting infected, my bone, and they said that they couldn't do nothing about it, so they had to amputate it.
Alrighty. So before that, you were telling me that you had one toe amputated, then another toe, and then they kept cutting and cutting. Is that right?
Yes.
All right. Now, you are diabetic, am I right?
Yes, since 2000.
2000. Since 2000, you're diabetic. And as a result of that, you got the infection and the poor circulation, correct?
Yes.
All right. Now, tell me, is there anything else, any other problems you have as a result of the diabetes?
Oh, my eyesight. I also lost my eyesight because of that.
Right. So you're essentially blind, am I right?
Yes.
How has this blindness affected your health?
Well, it's just, I don't know. To me, it really doesn't make a difference. I just live my own life the way I'm going, and I have to go with it.
So there is some disability there because you're unable to see, so you're a little bit more dependent on others to take care of you. Am I right?
Yes.
Okay. Is there anything else as a result of diabetes? Are you on dialysis?
Yes, I'm on dialysis. I go 3 times a week.
How long have you been on dialysis?
Since 2012.
2012. So here we can see that Mr. Vega is one of those patients who have had so many complications as a result of type 2 diabetes. Type 2 diabetes, 90% of people with type 2 diabetes can actually get rid of this disease. Is there any kind word you'd like to tell anyone who probably have diabetes but they haven't lost their legs yet, they have their vision, and they're not on dialysis? How do you advise anyone listening or watching us?
It's like I said, like me, I just keep on living my life the way God intended. I get around. At least I have friends and families that take care of me and help me. But just gotta take care of yourself.
Right. And would you say they should probably eat differently and make sure the sugar?
Yes.
Talk about that.
Oh yes, I eat, like Dr. Cooper said, I eat a lot of salads and then fruits, and that's about it. I try to stay away from red meat. I eat some chicken and fish. Just take care of myself.
Right. So the sugar is much better controlled now that you change your diet.
Yes, I just got off of insulin.
That's right. I just took you off insulin.
Yes.
That's right.
I feel better. I don't feel tired like I used to be, and I can walk around with my leg and everything around and get around.
All right. So as you can see, that diseases such as diabetes and high blood pressure, factors such as smoking can really, really disable someone. And as you learn, peripheral vascular disease can increase your risk for many, many diseases. As a matter of fact, peripheral vascular disease will increase your risk for dying from just about any disease. So therefore, you're encouraged to take care of yourself. If you have been with us since the start of the program, you probably now understand why we want you to take better care of yourself and therefore preserve your health and prevent yourself from losing a toe, 2 toes, and then eventually a leg. Because when that happens, you become very dependent. Mr. Vega, thank you so much.
Yes, ma'am. Thank you, doctor.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Dona Cooper and her team are ready to help. To order her books or the DVD series, Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonacooper.com today. We're Foodamed, a great restaurant with a healthy style, serving the best food and 100% vegan. Each dish with an exquisite and unique flavor. Bring the family, enjoy, and eat healthy. The best in food prepared by our chef and highly qualified staff. We're available. Consider us for your next event. All in one convenient location. Foodamed. All our food is plant-based with a variety of dishes. A wonderful variety and delicious. Yes, food is medicine. Foodamed. 6401 North 10th, McAllen, 956-731-4484.
Welcome back to Get Healthy with Dr. Cooper. There's so many people walking around with an amputated toe or part of the leg or the entire leg as a result of poor circulation. So the topic today is peripheral vascular disease. I have a specialist in my studio today, Dr. Pedro Mego. I'm going to call him on and he can discuss with you his title. Doctor, welcome to Get Healthy.
Thank you, Donna, for the invitation.
It's a pleasure. Why don't you have a seat? Tell us about yourself. Why are you so specialized in this area? Why are you the expert in peripheral vascular disease?
Let me tell you a little bit. After I trained in Arkansas and in cardiology and interventional cardiology, I knew that I was moving to South Texas. I knew that this population was kind of sick or higher sick than average, knowing the high prevalence in obesity, diabetes. But when I came here, I got with a surprise that I found what I was expecting, coronary artery disease, high risk of diabetes and obesity. However, I was not expecting the high number of amputations, people who already have amputations in this part of the country. And I have a formal training in peripheral artery disease during my interventional training, and I apply all that interventional training, expertise, and with time, I have been performing high-risk complications percutaneously, what means only with catheters, with no knife, only endovascular, and that is the specialty that I have. I mean, I am board certified cardiology, interventional cardiology, and also in endovascular medicine.
Very good. You did mention that here in South Texas, there's just a high prevalence of diabetes. That's one of the #1 risk factor for amputation of the leg.
Unfortunately, you are completely right. Similar than the coronary artery disease, diabetes is the leading cause of atherosclerotic disease in the legs as well, guiding to peripheral artery disease, as well hypertension, hyperlipidemia, smoking, family risk, obesity, renal disease, on hemodialysis, is the population that is at higher risk for this devastating disease.
That's right. I know I send a lot of patients to you. Patient might come into my office with pain in the leg, walking, gives pain, is as though they're having a heart attack in their leg, right? Because there's no circulation there, right?
Probably that's a kind of an easy way to see it, and thank you for your referral, Donna. We do the best that we can to offer your patients best service, as well any patient to arrive to our office,
That's right.
the best service possible. The way how we diagnose peripheral artery disease depends in symptoms, risk factors, and there is some auxiliary tests that can help us to diagnose this medical condition. The best way to check it, simple way, can be done in the primary care office as a screening is what is called ankle brachial index.
That's right.
Basically measuring the blood pressure in the ankles, in the brachial, and we do a ratio. No?
Right.
If it is near to 1 is normal, near to less than 0.7 is moderate, less than 5 is critically
Severe.
peripheral artery disease. That's a simple way how to stratify, but unfortunately it's not that specific. Unfortunately, there is a significant number of patients that could have normal or even elevated ankle brachial index that has severe peripheral artery disease. In the office, usually we do an ultrasound, arterial flow studies to check the circulation of the arteries in different parts of the leg. That is a very good test if there is a good technician and good physician interpreter doing that. If we are planning to do interventions, as specialists, usually with that, we straight go for interventional procedure. There are other tests that also can be done, like a CT scan or a magnetic resonance angiography. That is only reserved for persons who we anticipate that could be more complex than usual, and we can have a plan. We can plan ahead the procedure, but most of the time it's not needed, these other two tests.
That's right. So we're going to break it down for our patients. So patients who are diabetic, patients who have heart disease, they are at risk for poor circulation. We call it peripheral vascular disease, meaning therefore that the blood is not getting to the tissue, to the end point. There is some obstruction somewhere along the line. And the patient might have pain in the leg, or the patient might have an ulcer that does not heal.
Basically, the symptoms goes from asymptomatic when it's an early and mid stage, and when they become more severe, they have the typical claudication that you kind of mentioned, is pain in the calf when they walk, reduction in the physical activities because of pain, improve with rest, and if this gets worse, even has pain at rest, or even pain just lying the feet up, that produces pain. With this progressively gets worse, something comes to something is called critical ischemia or tissue loss. Tissue loss is that when there is an ulcer that is not healing, or some gangrenous toes, or pain at rest, that is a very critical condition in peripheral artery disease. That is a kind of similar than imminent heart attack.
That's right.
When somebody has a ulcer that is not healing for more than 2 weeks, a gangrenous toes or gangrenous tissue, and pain at rest, something to remember.
Let's talk about gangrene, because our audience might be thinking, what's gangrene?
Gangrene basically is the terminal stage of the tissue. We see a healthy tissue, pink, or depends the color of the skin, warm. When the circulation gets poor, becomes colder, the skin becomes thinner, the hair it becomes to get lost, and when this becomes even worse, become pale. When this becomes even worse, becomes dark.
Dark and
or
cold.
dark tissue, very cold. That means the tissue is already dead.
That's right.
Gangrenous means already the tissue is dead. And unfortunately, when the tissue is dead, it requires amputation.
Yeah, there's nothing you can do. It's die because there's absolutely no blood flow.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonacooper.com or call 1-844-343-8935.
So as you say, initially, no symptoms, but then the patient might have pain in the calf when they walk, or they might have cold limb, blue limb,
Absolutely.
loss of hair, shiny skin, and of course you mentioned the ulcer that does not heal. Now I send those patients to you, doctor. What do you do with those patients when you see them?
When already we did a diagnosis with non-invasive testing and we confirm the presence of severe disease, we perform an angiogram. Angiogram is the gold standard, the test that is done in the hospital, in which we put a catheter. It could be in the groin, or it could be in the tibial arteries in the next to the feet, and with that we can visualize the arteries inside the legs in this case, to confirm the severity of the disease, and if the presence of severe disease is there, usually we fix it percutaneously. That is my specialty.
You know, a lot of patients will ask me, how can they fix it when the vessel is so tiny?
Very true. We are talking about 2-3 millimeters arteries in the runoffs below the knee. Above the knee is significantly higher. No? But let me tell you, we as a cardiologist and interventional cardiology, we are trained to perform these procedures in the heart.
So imagine
the heart that is moving, the heart that has a lot of tortuosity arteries, that has a lot of branches. That means for an interventional cardiologist that has been working in a small area in the heart, doing the legs is significantly less challenge. However, I have to say that has their own challenge per se. You need to have create your own expertise, your own techniques. And also there are more tools in the legs than even in the heart to do the atherectomy or cleaning of these arteries.
Right. Who are the patients at risk for amputation?
Unfortunately, any patient who presents in these 3 stages, ulcers that are not healing, gangrenous toes, pains at rest, are at very high risk for amputation. And unfortunately, something that people don't know is having amputation is higher risk than almost any cancer. Mortality in somebody who has a toe amputation at less than a year is more than 25%.
When you say mortality, what do you mean? So
any kind of mortality, cardiac, non-cardiac mortality. These patients usually that has amputation, they are in dialysis, they have long history of diabetes, they have usually other comorbidities different just the peripheral artery disease. Most of them, they already have blockages in the heart, weak heart, cardiomyopathy, or other risk factors. In that way, mortality is more than 25% at 1 year. Risk of amputation in the other limb is more than 50% in 1 year. And when I am talking amputation, I am talking a large amputation below the knee or above the knee. What means is a condition that is unfortunately at very high risk. Also, this having a below the knee amputation, to tell you the truth, majority of the patients, they don't walk anymore. They are not able to get a prosthesis and ambulate again.
That's right.
Because, again, the other comorbidities. No? Usually these patients are kind of sicker than usual population.
Right. So we want to prevent the disease because as the doctor says that by the time the patient gets any amputation, the risk of death from anything is very high. Am I right?
You are completely right.
Right. Do you have any videos you brought us so that we can look at?
Yeah, I brought several videos.
Let's
and
walk
we can
over
go there.
here and see what you have.
Unfortunately, we have some technical difficulties, and the videos has been very difficult to see. However, we put some pictures.
Okay, let's
in
look.
that way, we can kind of. I think that the idea and the message will be able to be appreciated, and the arteries are like a tube system, no? Circulatory. The circulation basically is a continuation of tubes, and we are going to see the dark part is the arteries. You can go next, please.
Okay.
Oh, for example, this is a patient, 54, diabetic, who presented initially to another hospital, was transferred to the hospital where I practice, and you clearly can see a gangrenous toe.
That's
the
right.
foretoe is gangrenous, and you can see the distal part of the foot has redness, what is ischemia, pain at rest, in swelling, already
So
inflammation.
this toe is already dead. That's exactly what we mean.
Unfortunately, that toe is already dead.
All right.
But he already has been recommended above the knee amputation in another hospital. And he came to us, or to me in this
To
case,
save the leg.
basically as a second or even third opinion, because two doctors told him they will require amputation. And obviously, 54-year-old male, I mean, having an amputation above the knee basically is almost the end of his life,
That's right.
of productive life, I mean. And it basically will be a very, very difficult situation. No? If you can go to the next.
The next.
Yeah, unfortunately, go to the next. Oh, here, wait a second. Well, can you go back? If you can see, for example, in this patient, they told him they will require above the knee amputation, but the doctor was not sure it will be above or below. In this case, it's because, unfortunately, peripheral artery disease usually is a multi-level disease. No? In this case, it's in the iliac artery. This is the hip. We are talking about the aorta bifurcation, both iliac arteries. This is in the iliac artery. Left common iliac artery has a tight stenosis. I mean, the videos has not been able to be done, but I can see, you can show you the results, how is this finished. Now you can clearly see a very tight stenosis, and this is how it finished.
Fantastic. Great job here. Because in that one, you hardly see the flow. It's very obvious there's no flow there. And then you opened up, and then there's great flow. Fantastic.
Thank you.
Anything else?
Yes, basically in the same patient, you can go next, you can see a significant blockage at the level of the knee. And here also, this is the popliteal artery, the posterior, the tibio-peroneal trunk also has severe disease, anterior tibialis, and here you can see the anterior tibialis is totally occluded in this segment. No? And you clearly can see the popliteal, tibio-peroneal trunk, anterior tibialis, and also we recover this artery. Next, please.
Okay.
Here is the artery that was obstructed 100%, and now the anterior tibialis that is present all the way to the foot. And you can go next. And initially, the foot circulation was very limited, and clearly you can see now the dorsalis pedis with circulation to the toes.
Beautiful, beautiful.
You can go one more. In this gentleman, from above the knee amputation that was recommended in another hospital, from this you can go just to a toe amputation.
Right, and you can see the difference in the skin color here after the circulation is open.
That was approximately 6 weeks after. Clearly you can see the ischemic foot, the redness, you can see the swelling, the shiny skin, and this you can see already a skin with no more swelling and obviously no signs of ischemia.
Very good job, Doc.
I know that losing a toe, I mean, could look bad. However, losing a toe is nothing comparing to the leg below or above the knee.
I agree.
No? Especially in a 54-year-old person.
Who's very young.
Dr. Dona Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonacooper.com.
Let's see what Adrian has for us. I think he has some question on the street about peripheral vascular disease. Let's go to Adrian.
Hi, Dr. Cooper. I'm here with...
Araceli Huerta.
She has a question for you.
What are the causes for the peripheral vascular disease?
Doctor.
Yeah, basically the causes are diabetes as a number one factor, hypertension, hyperlipidemia, smoking, family risk, evidence of atherosclerotic disease in other parts of the body, obesity, and renal disease on hemodialysis.
That's right. So really they're just the same as that of coronary artery disease.
Unfortunately, atherosclerotic disease is a systemic disease.
That's right.
It does not affect only the heart, affects also the brain, risk for a stroke, heart, risk for heart attack, and the legs with risk of amputation.
Very good. Anything else? Any other question from Adrian?
Hi, Dr. Cooper. I'm here with...
Lina.
And today she has a question for you.
Hi, Dr. Cooper. What is the symptom of peripheral vascular disease?
Alrighty, so we discussed that already, Doc, but you can probably just give a brief overview of the symptoms again.
Like we mentioned, it goes from asymptomatic in the early and mid stage to claudications or atypical pain in the legs when it's moderate and severe disease. And when it's very critical stage is when it's non-healing ulcer, pain at rest or gangrenous toes or tissue.
Very good. So this has been quite enlightening for our viewers. Peripheral vascular disease is something you can prevent, because if you have amputation, your risk of death is higher than the general population.
Much higher.
That's right. Doctor, I thank you so much for
My
coming.
pleasure, Dr. Cooper.
And I'll have you again soon. Don't go away, we'll be right back.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Dona Cooper and her team are ready to help. To order her books or the DVD series, Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonacooper.com today.
Welcome back to Get Health with Dr. Cooper Kitchen segment. Today I have a very simple but nutritious recipe for you today. I have quinoa salad. Now quinoa, it's a whole grain that has a high content of protein, fiber, and all the good nutrients. I'll also be using black bean. Beans are the poor man's protein. Lots of protein, complex carbohydrates, lots of fiber for good health. I'll also be using garbanzo bean, same properties, proteins and fiber. I'll be using corn, roasted corn. Corn is a whole grain. It has all the fiber, all the nutrients, all the protein, and all the minerals. Let us start. So 2 cups of quinoa. This quinoa is already cooked. Very easy to cook. It cooks in about 15 minutes. Then to the quinoa, I'm going to add my already cooked black beans, 2 cups. I'll add some more beans, and that's going to be my garbanzo or chickpea, another 2 cups. And to this, I'll add another grain. This is my roasted corn, 2 cups, and this will give the crunch. To that, I'm going to add my pico de gallo, which is made of cilantro, onions, pepper. So we're going to mix that in. And to that, I'll add a pinch of salt. So a pinch of salt. Then I'll add my lemon juice. I'm going to squeeze this in. And if you like more lemon, you add lemon. This gives a lot of vitamin C. Now to that, I'm going to add 2 tablespoonfuls of olive oil, extra virgin olive oil. And you always should be careful with the amount of oil that you use in your diet, because oil is processed and high in calories. So be very careful. All right, so we have our extra virgin olive oil there. And then I'm going to spice it up with my pepper here, my cayenne pepper. So let's just, add a little bit of cayenne pepper, not so much out there, okay? So we add some cayenne pepper, and we're going to mix this in. So we're going to mix this in thoroughly, so we get all of our spices or flavor in. This is ready to go. Now this dish is very easy to prepare, as you have noticed. You could leave it overnight. It could be served hot or cold. This is a good one to take to work. Just pre-package this, and you have a whole meal ready, filled with protein, good carbs, lots of fiber to fill you up and for you to keep feeling fuller longer, and of course your minerals and your vitamins. Now, if you really want to stay healthy, to lose weight, reverse your hypertension and your diabetes, and lower your cholesterol, then you need to make this at home for yourself and your family. Now, children, you notice there's a surge of diabetes and obesity right now because of the diet we eat. So parents, if you model good, healthy diet, then your children will be healthy. So for more recipe or to learn how to live a long and healthy life, then join my community. Go to my website, gethealthywithdrcooper.com or .tv or cooperwellnesscenter.com. Until then, I'll see you again soon. To your health.
We're Foodamed, a great restaurant with a healthy style, serving the best food and 100% vegan. Each dish with an exquisite and unique flavor. Bring the family, enjoy, and eat healthy. The best in food prepared by our chef and highly qualified staff. We're available. Consider us for your next event. All in one convenient location. Foodamed. All our food is plant-based with a variety of dishes. A wonderful variety and delicious. Yes, food is medicine. Foodamed, 6401 North 10th, McAllen, 956-731-4484.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the wonder supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonacooper.com or call 1-844-343-8935. Dr. Dona Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonacooper.com.
Welcome back to Get Healthy with Dr. Cooper. Today our topic is cardiovascular disease, the #1 killer in the world and in the United States. However, you really don't have to die from this disease. I have a special guest in my studio today. He's board certified in heart disease as well as obesity. Dr. Pedro Mego. Doctor, welcome to Get Healthy with Dr. Cooper.
Thank you, Donna. Thank you for having me here.
My pleasure, Pedro. Can you tell us a little bit about yourself?
Sure. I am originally from Peru. I did medical school at San Marcos University, and then I trained internal medicine in New York and cardiology and interventional cardiology in Arkansas.
Very good.
Before coming and practice here in South Texas.
How long have you been here in South Texas?
Incredible, since 2005.
Wow, that's a long time. I came here in '96, so I beat you to that. Doctor, I know you have a very busy practice, right? Cardiovascular disease. Why is it so busy here in South Texas?
Yeah, we have been blessed. We have a very busy practice. Probably like most of our people knows, is South Texas and McAllen has been found to be the city, one of the most city with most obesity in the world, and that increased risk for metabolic syndrome, diabetes, and that increased risk for coronary artery disease, and probably that is one of the, and providing good service to our patients, that is in combination with that, we have a very busy practice.
I like the last one, providing good services to your patient.
Absolutely.
You're smart. All right, doctor, heart disease. Tell me a little bit, what is coronary artery disease really?
Coronary artery disease is called ischemic heart disease. Like probably we know, the body has the heart as a pump. Mm-hmm. The main function of the heart is to pump the blood from the heart to the body but the pump per se, the heart per se, has their own circulation. When these arteries to the heart get obstructed, it's called coronary artery disease. And unfortunately, this is significantly common, and unfortunately, this is the #1 cause of death in America, in the whole world.
That's right.
Unfortunately, and probably we're going to talk a little more about that, is the prevalence in South Texas is very high.
Right. So what are the risk factors? You said the prevalence is high here. Why is this so?
It is well known that diabetes, hyperlipidemia, hypertension, smoking, age, family risk,
Right.
sedentary lifestyle, obesity, renal disease has significant impact as a risk factors for coronary artery disease. And unfortunately, all of these risk factors are very high here.
That's right. So our listeners that are probably watching us, they might be wondering, do I have heart disease? What are some of the symptoms, doctor?
The most common symptom, the symptoms depends on the stage of the disease. If it is an early stage, we are asymptomatic.
Right.
However, if the symptoms are present, it means that person most likely has already moderate disease or even advanced disease. The main common symptoms are chest pain, especially related to exercise. If somebody could walk 5 blocks before and now hardly can walk a block or 2 blocks, and this is, they stop because of chest pain, in the way that is a very strong alert that they could have coronary artery disease. Shortness of breath, reduction in functional capacity are the other symptoms related to this.
So doctors like myself, internal medicine doctors, family practitioner, we send our patients to you. When you get to a patient, what do you do with our patients? How do you make the diagnosis?
Basically, we evaluate the patient, the risk factors, the symptoms, and if we find that they have significant risk factors and symptoms, we evaluate it with a stress test. That's the most common test, how we evaluate it. If the patient can walk and run, we make them walk and run fast as a protocol. If they cannot, we do a chemical-induced exercise. It's called a nuclear stress test, basically, if they are not able to walk fast enough or we estimate that they cannot walk fast enough. That will give us, if abnormal, will increase significantly the chances that they have coronary artery disease. Other tests could be exercise or chemical-induced with echocardiogram, or another one could be a CT scan, what is a CTA, a coronary CTA, with calcium scoring as well, can give us a close estimate of the coronary circulation.
But the definitive diagnosis is made by your left heart cath, right?
Basically, the gold standard.
The gold standard.
Gold standard for coronary artery disease is made with
So
catheterization.
you brought us some pictures. We're going to walk over here. We're going to
Sure.
look at a normal coronary, and then we're going to look at the abnormal ones. So we
Sure.
want our producer to put on the normal coronary, right? Because a lot of patients get scared. They say, oh, I need to go to the cath lab. And they get scared. Should they be afraid of the heart cath?
I don't think so. Coronary artery disease per se is a low-risk procedure. No? It's a procedure that has less than 1% complication risk. Majority of the doctors do it from the groin. I usually do it from the wrist. And with that, I can get access to the arterial system, advance the catheters to the heart, and inject some iodine contrast. And with that, I can visualize the coronary circulation.
All right.
And according to what we find, it depends what we are going to do.
All right, so let's put on our video for the normal cath so that our audience can see what the normal looks like and what the doctor does to relieve the stenosis. All right, so we're going to get it. There it is, doctor. It's right behind you.
Basically, this is almost normal because we're rarely doing a normal patient, but some patients, even having what we call abnormal stress test, the coronary arteries are not that bad.
That's right.
No? For example, this is the right coronary artery. There is a little lesion here if you go in detail comparing to the normal side. In the heart, there are main 3 arteries. No, one, 2 coming from the left main, the bifurcation in the left circumflex, and the left anterior descending artery in the front of the heart. And the one that we saw initially was the right coronary artery. Basically, this has minimal obstruction, only mild luminal irregularities. For this patient, is good news. Only we need to continue controlling cholesterol, diabetes, hypertension, antiplatelet therapy, but we don't have to do any intervention for him.
And lifestyle.
Lifestyle, very important.
Right.
Very important.
Treat
overweight, treat obesity, increase physical activities progressively as much as tolerated.
And the diet is important.
Like probably you have mentioned strong enough, our diet is the #1 cause of our overweight and obesity.
There you go.
And we need to work on that.
Very good. Let's move to the next one. I think the doctor has some more.
Both of these cases has been done this week. If you have one before this, I think, in this one, for example, this is the left anterior descending, and here, this artery should continue all the way here. But you can see it's obstructed.
Yes.
No, and this actually is my wire that I am trying to cross this area of 100% occlusion.
Right.
If you can go to the next one.
Go to the next one.
I think this is the original one. If you can see it, this artery, it gets obstructed here 100%.
Yeah, you're losing it there.
Here, you don't see it anymore, and this artery should continue there. This is my wire that now is in the apex, in the distal part of the heart. Now I put a balloon, and this is when I am inflating a stent, where is a small metallic piece that keeps the artery open. In the past, we used to do only balloon angioplasty, then we did with metallic, but now we have a medicated stent. No? Like you can see this stent here, and now the artery goes all the way to the apex.
So you opened this.
I opened that artery.
Fantastic.
No? Yeah. And this is a patient, for example, that came to the hospital with chest pain, shortness of breath. Actually, we already knew that this one, another cardiologist did it, and was obstructed in 2015.
Wow.
And I mean, with experience and some techniques, we are able to open these arteries, even if they were obstructed 100%.
Wow.
He was considered a poor candidate for bypass at that time, and they said with medication, but he was not doing good with medications, chest pain, shortness. In this patient, he's doing fantastic. His benefit, he has already noticing benefit the day after.
That's right, because now we have the blood flow getting from the origin down to the muscles, because you opened up so the flow can get there. So his pain should have improved.
He was very surprised when the next morning he could walk outside the room with no chest pain, no shortness of breath, something that he didn't experience for years.
Good, Doc. And I hope you counseled him on lifestyle.
Very important, very important. Like no more emphasis. I will never get tired to emphasize the importance of improving our diet. Like probably we know 80 to 90% of the problem with obesity is not a lack of exercise, it's our diet.
That's right.
And we need to improve that even more than doing exercise. Improving our diet is the main factor to have a better weight.
That's right. Studies have shown that the #1 risk factor for chronic diseases, diabetes, obesity, heart disease, and cancer, it's the food you consume. So doctor has just showed you how he treats coronary artery disease. However, if you have heart disease, and even though you have a stent or a bypass, but if you continue to live the same lifestyle, you're still overweight, the blood sugar is not controlled, the blood pressure is not controlled, you're eating a lot of fat, a lot of fried foods, you're going to block up the coronaries again. So you have to ensure that you take good care of yourself. Doctor, is there any last minute word you want to say to the viewers?
There is no, it is very important that at a certain time in your life you need to put emphasis in your health. And this time, the best time to do it is now.
That's right.
Not yesterday, not tomorrow. Let's do it now. You didn't do it yesterday, do it now. And emphasizing, trying to do a healthier lifestyle, improve your diet, try to get into an exercise program, and consult your family doctor. No? And if your family doctor recommends you to be seen by a cardiologist, follow that advice. And here in South Texas, we would love to take care of you.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Dona Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonacooper.com today.
I think we have Adrienne out on the road with some questions for you, doctor. So we're going to go to Adrienne and some questions. Let's see what he has. They're going to come right on the screen.
Hi, Dr. Cooper. Today I'm here with
Angel Guerra.
and he has a question for you.
My question is, can I get high blood pressure as a young person?
Doctor, you want to answer that?
Yeah, unfortunately, the answer is yes. And we are seeing significant chronic diseases at much earlier age than before. For example, in 1990, diabetes in teenagers did not exist.
That's right.
And now, because of the obesity epidemic that we are living in the United States, now we see it very frequently even in kids.
That's right.
Same thing happened with hypertension. Hypertension used to be a disease of elderly, no? What we call primary hypertension, but now we can see it at younger age also because of obesity. There is, that is like the primary hypertension. That is also called secondary hypertension, and anyone who is younger than 40 should be evaluated, with hypertension, should be evaluated for renal artery stenosis, or that basically means
Not enough blood getting to the kidneys.
and the kidneys are producing a hormone that increases the blood pressure. No? Anyone who is, has 3 medications and has no well control, anyone who has worsening in the last 6 months, or anyone younger than 40 years old should be evaluated for renal artery stenosis.
Very good. Let's take one more question from Adrian. Let's see what he has for us.
Hi, Dr. Cooper. Once again, I'm here with
Alia Juarez, and are overweight people at a higher risk of having heart disease?
Overweight people, are they at higher risk of heart disease?
Unfortunately, yes. Something also called metabolic syndrome. What is metabolic syndrome? Basically is the group of factors that per se does not diagnose diabetes, hypertension, or hyperlipidemia per se, but when you even having not at the risk to be diagnosed in neither of these diseases, increase already your risk for coronary artery disease. In that way, overweight and obesity is one of them. No? In that way, yes, unfortunately, obesity can increase your risk of heart disease significantly.
That's right. Well, doctor, it has been a pleasure having you. Thank you so much. And you stay right there. Don't go away. We'll be right back with more on cardiovascular disease.
Dr. Dona Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonacooper.com.
Hello, everyone. Welcome to Get Healthy with Dr. Cooper, the kitchen segment. Today, I have a very, very important topic to discuss with you, and this is just healthy swap. I know many of you are thinking of changing lifestyle, but you don't know what to eat. What should I change in my diet so I can have healthy, nutritious diet? So we're going to start here with processed food. You notice I have sugar, white sugar. This is bad for your health. White flour, remove that totally from your diet, because this will increase your risk for diabetes, hypertension, many chronic diseases. What about oils? I get a lot of that question at my office. Now, oils, you should stay away from oils because they're processed. However, there's some healthy oils that you could probably use in your diet. Grapeseed oil could be used, extra virgin olive oil as well. However, the best fats are from nuts. So you see I have several different types of nuts here, and if you're allergic to some type, choose the better nuts. Walnuts, any nuts, these are good for your health. Now you might be asking, how do I sweeten my pastry? Now, it is good to use fruit, natural sweetener. You could use banana, you could use dates, apples, or whatever you have in season. However, if you need some extra sweetening, agave is natural and it has low glycemic index. So this should not affect your blood sugar that much. Now, many people believe that when you become a vegetarian, then there is nothing to eat as protein. So let's look at your choices for protein. All the lentils, legumes, peas and beans, these are high in protein, high also in complex carbohydrate, and as well as other minerals. You know, it is believed that legumes and beans are the poor man's protein. So eat lots of this and you will stay healthy. Also, seeds. This here pumpkin seed, this is also high in protein. Don't forget your chia seed, flax seed, also high in omega-3. Now what about dips? Healthy dips. Rather than having cheese, you can have healthy dips. Hummus. Hummus is a bean dip made from chickpea. We also have avocado. Avocado is also high in good fats. And of course, if you want something very easy, you can find, you know, mayonnaise, veggies, which substitute mayonnaise at the store. Now grains. There are a lot of people talking about grains, when to eat grains, how to eat grains, what grains are healthy. Now I have whole grains for you. Quinoa. Quinoa is high in fiber as well as high in protein. I have bulgur wheat. This is wonderful. This can be used to substitute rice or even as a sweet cereal as well in the mornings. You have brown rice, black rice. These are healthy. And also pasta. You can have whole wheat pasta. This is healthy. Now, for the children, some children like a lot of sugar in their cereal. That is so unhealthy. Mothers, fathers, try to use oatmeal and use the rolled oats. There are several ways to prepare this. You can go to my website and find different recipes for oat recipes. Now, remember, it's very easy to swap out unhealthy food and swap in the food that you can use as medicine. The number one risk factor for diabetes and chronic diseases, it's the food you eat. However, food can also be your medicine. So for more information on how to stay healthy and how to prepare healthy meals, go to my website, gethealthwithdrcooper.com or .tv or cooperwellnesscenter.com. I'll see you again next time, same place, same station.
We're Foodamed, a great restaurant with a healthy style, serving the best food and 100% vegan. Each dish with an exquisite and unique flavor. Bring the family, enjoy, and eat healthy. The best in food prepared by our chef and highly qualified staff. We're available. Consider us for your next event. All in one convenient location. Foodamed. All our food is plant-based with a variety of dishes. A wonderful variety and delicious. Yes, food is medicine. Foodamed, 6401 North 10th, McAllen, 956-731-4484. Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Dona Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonacooper.com today. Dr. Dona Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonacooper.com.
Welcome to Get Health with Dr. Cooper. Do you have diabetes and want to get rid of it, or high blood pressure and want to improve your blood pressure? Then we have something special for you. Active living 30 minutes a day or 60 minutes a day will cure your diseases. Ramsey, what do you have for us today?
Hello, Dr. Cooper. You're right. I like that explanation. What we have today is just going to be an exercise with resistant bands, going to focus on the lower body. We have our beautiful ladies here just to show us. We're really going to focus on the front squat right here. We're going to use a little bit more abdominal muscle to sustain us. Here, we're going to have the girls bring the resistant bands all the way up, drop all the way down. Let's go. We're going to get a good 5 in. Here, we really want to focus on bringing that butt as low as possible and keeping that back straight. Keep that back straight. Don't try to lean too much, especially with this exercise. We do have the instance to lean a little bit more, but just try to sustain yourself and go as low as possible. For some of us, we can't go that low, so again, push yourself to go as low as possible. We're going to go at least 15 to 20. 15 to 20, 4 sets. 4 sets total, 15 to 20. Now the next one, we're going to do a straight leg deadlift. Straight leg deadlift with resistant bands. We're not using any weight in this. All we're doing is going down as low as possible, keeping the leg straight, coming up. Not everybody has the same flexibility, so try to push yourself as much as you can. It's not easy, but try your best. Again, we're gonna go 15 to 20, 3 to 4 sets. 3 to 4 sets, depending on how you can. It also depends on the economy of what you can do. Just try to push yourself as much as you can, okay? Now what we got is a single leg kickback. Just bring it back. Same thing, if you feel comfortable with your hands on your hips, do it with your hands on your hips. If you feel comfortable with your hands up in front of you, do the same thing. There you go. Here, 15 to 20, we're just trying to get that muscle conditioning back into play. We're just trying to get our muscles back under us. 15 to 20, 3 to 4 sets. There you go. And don't forget, we got both legs, 15 to 20. And that's our segment for today. Dr. Cooper, thank you for having me. This was quite an experience.
Thank you, Ramsey. Thank you. I notice they need a lot of balance for this exercise, right?
Yes.
So,
a lot of core.
There you go. You out there, if you have difficulty balancing, just go slow. And remember, if you want to live a long and healthy life, you must move. Exercise is important for good health. We'll be right back. Don't go away.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonacooper.com or call 1-844-343-8935.
Welcome back to Get Health with Dr. Cooper. Today you've learned that cardiovascular disease is the #1 killer. But there is hope. If you are diabetic, if you have high blood pressure, if you walk and you have chest pain, if you're overweight, then probably you're at risk for heart disease. But there is hope. Remember that the #1 killer for any disease really is the food you eat. So start today by cutting back on food with too much cholesterol, animal products, red meat, cheese, oils, and start increasing plants, fruits and vegetable nuts and seeds in your diet, and you will be on your way to good health. I do know that it's not easy to change lifestyle, but remember there is hope. Our Heavenly Father wants to help us. And in Philippians 4:13 it says, I can do all things through Christ who strengthens me. So don't hesitate to call upon Him for help. I'll see you next week. Until then, may the Lord bless you richly.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonacooper.com.